everyone. Welcome to today, September 24th, virtual town hall on our transformation initiatives. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Happy as usual to play the role of moderator for our Q&A and introduction today to the virtual town hall. This is a webinar update for leaders specifically. We're joined here with a number of our senior leaders working on some of the transformation projects to give updates on where we're at, things you need to know, things you need to do. So why don't I introduce a few of those folks right now. So today we have our President and CEO, Rob MacIsaac, our VP Community Medicine and Population Health, Sharon Pearson, our executive sponsor for the HIS project, Dr. Barry Lum, our Vice President of Finance and Deputy Chief Financial Officer, Michelle Beals, our EVP Academic, Chief Medical Executive, Dr. Michael Stacey, and our VP of Clinical Support Services and Surgery, Leslie Gauthier. So a really great panel today. We'll have a chance for a Q&A later at the end of some presentations. At that time, you can use your chat function or the Q&A function, or even raise your hand in the participant section to ask a question live of those that are presenting. So we'll look forward to some great dialogue then. I guess over to you at this point, Rob, to kick off our agenda and take us through where we're going to go.
Yeah, thanks very much, Aaron, and thanks very much, everybody, for tuning in today. So we are going to do a review of the principal initiatives that are going on that fall within the umbrella of transformation at Hamilton Health Sciences. I'm going to just give you a brief overview and reminder of what those initiatives are. And we'll do a deeper dive into the Strategic Performance Collaborative, which is a unique initiative we have underway with GE. We'll talk about some of the important progress that's been made with our hospital information system, arguably the largest, most transformative project under this bundle. Give you an update on the work that we're doing around standardization, developing a standardized approach to collecting and storing data within Hamilton Health Sciences, which perhaps doesn't sound fascinating, but it's super important. Talk about the next steps in getting to maturity under CQI and operational excellence, and give you an update on our managed equipment supply initiative, which is well underway. So, first, I want to talk a little bit about this graphic, which is a very nice representation of our strategy, our strategic directions, and the biggest initiatives currently underway. You would have seen this graphic many times, but as you might notice, we've added a sixth initiative to this graphic, and that's Our Healthy Future, to acknowledge the significance and impact that our capital planning work will have on the future of Hamilton Health Sciences. Many of you will be aware that we continue to pursue some key redevelopment projects, including the rebuild of our West Lincoln Memorial Hospital site, and that's proceeding at breathtaking pace. And the redevelopment of our Juravinski Hospital and Cancer Center site, which not quite on the same rapid track, but is still progressing nicely, still an important project for both the city and for the province. Moving forward, you'll receive Our Healthy Future updates within the context of our broader transformation agenda. You'll also notice that we've replaced the digital health plan icon with a hospital information system icon. So this change isn't to suggest that the digital health plan work is no longer important as we seek to transform HHS. For sure, investments in our technological and digital infrastructure continue to be necessary if we want to move forward as a leading healthcare organization. And they are really part and parcel of our being able to implement HIS well. But today, the most immediate and significant investment we're making is the renewal of our hospital information system. So we have made that change to signify the focus and the effort. Our digital health plan, among other key corporate plans and projects, as I said, continues to be critical to our success. And so we'll continue to work that plan and to keep you up to date on initiatives that are going on under it. Today we'll hear updates about a few of our transformation initiatives, some of which have major milestones approaching this fall. I'm going to turn it over to Sharon Pearson to provide an update on our strategic performance collaboration initiative.
Great. Thanks, Rob, and hello, everyone. I'm happy to be here today to update on the status of our partnership with GE as we work towards our strategic performance collaboration. Our move forward with GE has certainly been a little bit stymied by COVID because that team, if folks will recall, is primarily based in Texas. But we have been working through them to look at some quite advanced digital virtual options and also looking at what support could be provided by some of their Canadian partners that could work with us more directly. So great work to move that forward. And I do this at every update, I know, but I think it's really important to remind everybody that this collaboration with GE is much different than our traditional consultant partnerships that we have. And firstly, it's because it is a risk-sharing partnership that we have, and GE is investing considerable financial and human resources into the partnership. But also it has the potential to be a multi-year partnership, which again is much different. And it does embed their staff with our staff together as we work jointly towards opportunity. So it is much different than what many of you have been exposed to in the past with some of our work with the other vendors. The other unique element about the SPC is it really is a critical partnership in that it is the mechanism or the vehicle by which we can help realize the efficiencies and the opportunities from our other large transformative projects like the HIS and the MES. So really important partnership, really unique, and very much looking forward to see how this plays out in the upcoming years. In terms of where we're at right now, so everyone's aware, there's really two streams of work, a quantitative stream and a qualitative stream. There's a lot of data going back and forth with GE, along with our planning and analysis team, along with HR. So a lot of exchange of information right now. And we're also meeting with a number of leaders, and many of you would have had these meetings or you have them in your schedules right now. These are important meetings because this is the mechanism to help GE along with us really scope the work, inform the work, scope the work, and define the projects that we will select to work on first. So thanks everyone in advance for freeing up that time in your schedules. It's really important that they hear from the critical stakeholders, and we'll be moving from the leaders to other meetings with your teams and with staff and with the physician group as well. So again, thanks in advance of that. Once we get through this phase, obviously, as you would expect, we'll be looking at working groups and we'll be out talking about our different committee structures and governance structures. So that's a very quick update on SPC, but it is progressing very well, and I'm very excited about moving it forward with all of you. So with that, I'll hand it right back to Rob.
Thanks, Sharon. I'm going to call on Dr. Barry Lum to give us an update on the hospital information system. Many of you will be aware that Barry is still in recovery after a lengthy sentence with, as being our physician in chief. In order to assist with his transition out of that very heavy role, we've given him some light work to lead this project of the hospital information system. But we're super lucky to have him leading this. He's doing a really, really good job. So Barry, over to you.
Well, that's very kind of you, Rob. Thanks. Hi, everybody. So I'm just going to have 3 slides, and I'd like to start by just giving you one more time a brief overview of what a HIS, or Hospital Information System, really means. And I think the word transformation can't be said often enough in the world of HIS. We are going to transform our clinical world entirely as we move to go live with our HIS. We should never lose sight of the fact that the patient sits at the center of everything we're meant to be doing. And the nice thing about this is we can reliably and comfortably look our patients in the eye and tell them that we're going to make their care better. It's going to be safer. There will be a single source of truth, and they'll be able to move across the entire enterprise of HHS, knowing that all of their information follows them along everywhere they go. But if you go over to the other side of the equation on number 5, the other thing that this is going to do is allow us through processes of interoperability to ensure that the patient also moves smoothly across the community and the other healthcare institutions, St. Joseph's Hospital, and all our other partners within the Hamilton Health team. So this is an opportunity to transform the care we provide within HHS, but also, of course, to make the patient's journey across all of their transitions it better. We hope that that's going to be associated. Can you go back one, Aaron? We hope that you'll see that that also will improve your and your colleagues' work life. It will be easier to manipulate your way around the system. It'll be nice to know that you can access all of the information you want when you want it. And that's going to allow us to feel comfortable that we're providing the safest and the smoothest care that we possibly can. And at the end of the day, we're also about education and research, and our learners and our ability to strengthen our mandate as an academic institution will also improve. Next slide, Aaron. So this is meant to be both informative and a bit shocking. This is complex. It's going to be the biggest transformation that we've ever attempted. And you'll see here a whole long list of milestones that we will be trying to achieve. We will achieve as we go forward, and you'll continue to hear about this step by step as we go along. Next slide, Aaron. So we are very busy at work, and there's a lot going on every day on the HIS file. We continue to work to finally establish our vendors in a contract. We are committed to going down an EPIC path. We don't yet have a formal contract, but we have a very clear and tight timeline to get us to a formal contract, hopefully in the very mid part of October, so that we can begin training our new hires that you're all aware of literally the last week of October, so that they can start to expand their expertise, understand where they're going to live within the HIS world, and a full court press on implementation to start in January. We expect that we will be in a position to formally notify all of the various applicants who have been successful in their application to us to be part of the team literally within the next few days, and that work is ongoing literally today as we speak. So we really are moving forward. It's going to be massive, and we absolutely need everybody's help as we go forward. Thanks, Aaron.
Thanks very much, Barry. Great update. So we'll go now to Michelle Beals, who is leading the work around data and analytics enabling work. And when you consider the sum total of all that we're doing in terms of our data capability, both with the HIS, but with these other very significant projects, it's pretty exciting to think of what our abilities will be in a fairly short period of time. So Michelle, over to you. Can you talk a little bit about this project?
Sure. Thank you, Rob. So as we have talked in the past about our digital health plan, it's really looking to transform our systems, our tools, and our processes, including those that we use to support planning, analytics, and reporting at HHS. We know in our current environment, there is incredible resource constraints and challenges we face within our organization and across the broader health system. And as a result, there is deeper demands for more responsive and more comprehensive analytics to support decision-making and good organizational outcomes. And essentially what it means and why we continue to invest in this is we simply outgrown our technology and our processes, and we are looking to move those forward. If we go to the next slide. In terms of what this means and what we should be expecting to see happening, in November, we will be launching our CPM tool, our Corporate Performance Management Solution for budgeting and planning. It's referenced as Axiom, and it will be available for leaders and will enhance our ability to plan, to budget, and to forecast as well as report. In addition to this, leaders can expect a full rollout of what we will be reporting or referring to as My Insights, which is a reporting portal, and that will be coming in the next coming months. And essentially this portal will be an interface between our data, projects, and allows leaders to really interact and access information in an intuitive and a robust tool that allows more visualization, which will help support that decision-making. Some of our leaders are already accessing information on My Insights, and if you've been leveraging or looking at any of our COVID dashboards or reports, that is the platform that is actually used to support that reporting. And along with the technology introductions, we are also looking to think about our structure and our support and how we help people navigate and make those decisions. And we will be looking to align our internal teams, both in P&A, finance, and decision support, to allow for greater focus on enterprise-wide streams to support this work, focusing on volume and service, labor and workforce, and non-labor. What do you need to know, or what do you need to do? Future information on Axiom will be coming in the next 4 to 6 weeks, along with training opportunities and engagement. And those will be shared through, updates will be shared through leadership communications, transformation webinars, and as well the hub. We will be launching Axiom in November, and there will be corresponding training, which we will be leveraging the LMS system to do, as well as that, and that training will be in more bite-size, digestible portions. And as well, we will continue to support all of the access or questions we may have and help with that transition within our P&A team. I think that's it for me.
Okay.
Thanks, Rob.
Yeah, thanks, Michelle. That's great. So, I mean, all of you are well aware that we've been on this journey to operational excellence for a number of years now. And, you know, I think we've made great progress, particularly at the front line. The journey is not over. And I think especially in the balance of the organization, sort of from the front line through to the C-suite and the board, we need to do a better job of making sure we're, you know, really taking full advantage of the continuous quality improvement system. So we have identified, or at least we're in the process of identifying, you know, so how do we make sure we're carrying on this CQI journey in a responsible way that really starts to try to harvest the benefits of all the investments that have gone before. So I'm going to turn it over to Michael Stacey to talk a little bit about where we are with CQI and where we're headed.
Yeah, thanks, Rob, and thanks for that introduction. So I think, as Rob has pointed out, we are continuing down this journey of operational excellence, as really is the term that we're using for it now. And so we're about to move into the next phase of CQI as we know it. which I think will be really exciting for us as an organisation. So we're looking to move to that phase, and as part of that, it's really sustaining this operating model into the future. And the key elements we're doing with this is we're looking at that better vertical integration. So connecting the problem solvers at the front line with those at the senior level. And that will also enable us to deploy the strategy to the front lines to drive those organisational priorities and to have all of that work really connected to our vision as an organisation. The key thing too is with this, we're building a structure that will help us to prioritise and provide capacity really for a lot of the systems work that's happening across the organisation. If we go to the next slide, thanks. So a really key thing to acknowledge is that we have achieved now 5,000 improvements through this work. And the other thing I think to really acknowledge is that the work that's happened with this culture change has really enabled us and empowered us to move forward with a lot of the transformative work that's happening across HHS, which you've heard about from the other speakers. But as well as getting that culture change, that will also help us move towards the next step in operational excellence. And I think it was also encouraging to see from the recent My Voice Matters survey that HHS staff viewed CQI as a powerful approach to fostering the culture of improvement in the organisation. So where we're going now is we're evaluating the current state. So there's an assessment going on, really supported by our quality and value improvement team with some external assistance. And in this process, there will be some interviews and focus groups, as well as you'll see people attending some of the huddles to really understand where we currently are at, and then to develop a work plan for the future to guide us to the next level of operational excellence. So we encourage you to make yourself available for those discussions and interviews and focus groups. And we are attempting to keep this as light as possible, acknowledging all of the other demands on all of you in the organisation. So what's coming next, as well as that work plan being developed, is we have a booster program for the leaders starting in October. To empower them to actually embrace this next level of operational excellence. And the wave 10 of training is starting in this fall as well, and there'll be a combination of in-person and virtual training with that. So lots of exciting things happening. We're seeing this move really coming to life with operational excellence. So I'll hand that back to you, Rob.
Yeah, thanks, Michael. And I think it's a really timely piece of work, given some of the feedback we got from My Voice Matters, where some of the frontline leaders really felt disconnected or unaware of the strategic priorities and the vision of the organization. So this work will be aimed very directly at solving or overcoming that issue and making sure that everybody in the organization has a sense of how their role contributes to the big priorities and vision and mission of the organization. So I'm now going to ask Les Gauthier to come in. Les is leading the Managed Equipment Service contract, which is such a key element of our ambitions to get to an evergreen state of capital equipment within the organization. This is a huge step in that direction, and lots of exciting things happening in this regard. So Les, over to you.
Hey, good morning, everyone. The updates from MES are starting to get exciting in that we're starting to actually see pieces of equipment come onto the sites. So to start with, we have initiated the purchase orders to replace our PACS workstations, some of our EEG monitoring equipment. Very exciting for West Lincoln is the C-arm arrived last week on site, and this piece of equipment actually means a different profile of surgical procedures that can happen in the ORs at West Lincoln. So exciting to advance the surgical plan for the West Lincoln site. And there's a number of project teams that under Sarah Adams' leadership and Cheryl Malcolmson have been formed. A working group to look at the McMaster MR on queue to be completed in the spring of next year. The West Lincoln CT installation, the Juravinsky replacement of the endoscopy ERCP suite, echo machines across the organizations for both adult and children, in our general radiology rooms. So super exciting, and for every site, there's something that is coming forward. The message in terms of what's most important that our frontline teams need to know is just the reminder that MES was a partnership to replace our equipment. But the other really important part is that Siemens is taken over the maintenance and the repair on all of our equipment. So the contact numbers are in the slide here. And just to remind teams, if they are having issues with any of the diagnostic equipment, their contact is the numbers that are here on the screen. In terms of what's next, there's a very big initiative that will start, and that is the replacement of our ECG machines. And this is really important work that will go from the physician writing the order for a 12-lead ECG to the taking of the ECG with the equipment. And then we'll eventually go to how do we archive that ECG that has been taken. This will be a very big multi-site, multidisciplinary team that will be coming together within the next month. And again, this will be co-led by Sarah Adams and Deb Bedini to balance the equipment with the clinical piece. So lots of work underway for MES, and it's all pretty exciting. Thank you.
Okay, I think we're going to go over to Aaron, who's going to facilitate Q&A. Thanks, Aaron.
Yeah, no sweat. So great presentation today. I always learn something new every time we have one of these, even though I've seen the presentation beforehand. So great stuff from all our presenters. Have an opportunity now to do some questions or even comments, feedback. So there's two ways you can do that. You can type something in. You can do that in the chat function or the Q&A function, or you can raise your hand in the participant section and we'll call on you to ask your question live. So looking now, I don't have any hands up. And I don't have any questions coming in. Maybe I could throw one out there, and I'll just randomly, maybe a question in my mind, Sharon, if I could ask you a little bit around the SPC work that you talked about. Maybe what are some of the early focal points for those discussions, some of the kinds of things that we'll be rolling up our sleeves and thinking through with GE, presumably some things maybe that we already have underway that they can lend some heat to, presumably some new things. Can you talk a bit about that?
Sure. Many of you that participated in the co-creation sessions back in March and February last year will recall there's three streams of activity: the labor, the non-labor, and the patient care optimization. Obviously, three great big buckets. And if you think about those buckets, pretty much everything in our organization falls into one of those buckets. As we work through GE, the ideal model that can support this work during COVID, we are focusing on the labor and the non-labor and looking to see what opportunities we could still move forward in patient care optimization. So a very easy example is around the labor piece, could be around, are there better ways we could try to address our overtime premium pay? Those are legacy, both of those, premium pay and overtime. It's a legacy issue in the organization. Are there creative ways that we could look at that differently? We are still going to explore the patient optimization strategies, which would be around patient flow, discharge planning, admission avoidance strategies, etc. The other big piece of work, is I don't think it would be a surprise, is really understanding our ambulatory areas in the clinic activity, particularly the impacts of COVID, looking at virtual care, etc. So that's these meetings with the leaders on the call today are so important because we really need input into how to scope these initial areas of focus and really define those particular initiatives that we feel collectively would have the greatest impact on HHS.
Great, thanks a lot for that. I see a question here. We have one from Denise who's asking, what can leaders expect to learn from the booster program that's coming out in October for CQI? So Michael, maybe we'll put that one to you.
Yeah, thanks, Aaron. So I think in the booster program is really, firstly, ensuring that the leaders really have a sound knowledge of the principles of operational excellence and how they might apply to their own situations and their interaction with those staff that report to them, but also have just refresh their knowledge of the CQI process as it aligns to the frontline staff. So it's understanding the principles of CQI as we have it, refreshing that knowledge, but then also looking at what is the plan going forward and what are some of the requirements for the leaders to engage with those groups. They're probably the key principles without sort of going into it in a lot more depth.
Good stuff. Thanks for that answer. So I'll do another call out to the group. We always aim to be on time, but we have a little bit left if you'd like to ask a question or make a comment. Of course, if there's something that comes to your mind after today's webinar, you can always send that to HHS news@hhsc.ca, and we can get you an answer very quickly that way as well. So not seeing any additional questions here. Maybe one parting comment. I really did like, I think we should all take heart with Barry's comment that you can never say transformation enough. And that's certainly true in our department, and I'm sure elsewhere in the organization too. Maybe Rob, over to you for some closing remarks, and we'll leave it at that for today.
Thanks very much, Aaron, and thanks again, everyone, for taking time to catch up on the work that's going on around transformation at HHS. I know many of you are involved in these projects at the planning or the implementation level, so thanks very much for the energy you continue to bring to this work. We know you're juggling many competing priorities. We will continue to try to keep you well informed on all of these things via email, the hub, and through other channels between now and our next webinar on October 19th. And with that, I will say enjoy the rest of your week. Thanks, everybody.